Good evening, everyone. My name is James Testaverde, and I am the Senior Director of Patient Services at the Crohn's and Colitis Foundation of America. On behalf of the Foundation, welcome and thank you all for attending today's program entitled Managing the Costs of Your IBD Care. Within the next week, you will be able to access the audio recording of this webcast on our website. For this and our other webcasts, please visit the following website, www.ccfa.org/resources/webcasts. I hope that all of our webcast participants can see the title slide and hear me. If you are having difficulty hearing through your computer speakers or headset, please dial in at 1-877-309-2074 and use access code 526-844-277. After the presentation, we will answer some questions from our webcast audience. Webcast participants can ask questions at any time during the presentation by entering the question in your control panel, which should appear on the top right of your screen. If we are not able to answer your question, our IBD Help Center can be reached Monday through Friday, 9 a.m. to 5 p.m. Eastern Standard Time by calling 888-694-8872 or by emailing info@ccfa.org. I now have the pleasure of introducing our speakers for today's program. Karen Hansen has been a nurse practitioner in the Division of Gastroenterology and Hepatology at Mayo Clinic in Rochester, Minnesota for the past 12 years. She has extensive experience caring for patients with IBD and other GI disorders, and Karen currently serves on the Nursing Initiative Committee of CCFA. Suzanne Benuna has been a medical secretary in the Division of Gastroenterology and Hepatology at Mayo Clinic in Rochester, Minnesota for the past 13 years. In this role, she provides secretarial support for 3 physicians and 1 nurse practitioner, all of whom specialize in the care of patients with IBD. Ms. Benuna serves a core operational role for issues related to medication coverage, such as copay assistance and patient assistance programs. Lastly, Elizabeth Messenger is the Director of Outreach and Education at Needy Meds in Gloucester, Massachusetts. Elizabeth works to increase awareness of Needy Meds resources by facilitating various advocacy and outreach efforts. Elizabeth also develops and maintains strategic partnerships with other nonprofit organizations and communities that support the mission of Needy Meds. In addition, Elizabeth oversees the Needy Meds webinar program, which includes monthly webinar tutorials explaining how to navigate the website's resources, as well as hosting special sessions on relevant topics. We are very excited to have these wonderful speakers with us today. And without further ado, I will now turn the program over to Karen Hansen.
Well, thank you, James. Next slide. So good evening, everyone. I'm just going to review some of the objectives for tonight's talk. What we want to do here is discuss the financial burden of IBD first, and then review some of the resources available to assist in the cost of medications as well as in care, to improve understanding of insurance coverage that is available, to become familiar with the Affordable Care Act and some of the changes that are taking place with that, and finally to review the rights that you have in terms of disability, medical leave from employment, and Social Security benefits. Next. So just a brief review. What is inflammatory bowel disease? Well, of course, we all know that these are chronic autoimmune inflammatory bowel conditions. This includes ulcerative colitis and Crohn's disease. And IBD is caused by a combination of genetic, environmental, and immune system imbalances in concert, creating a chronic inflammatory process in the bowel. The primary symptoms can vary widely, but include bowel urgency, diarrhea, or sometimes even constipation, blood in the stools, abdominal pain, and cramping, among other symptoms. And of course, we have no cure, but we can usually do a pretty good job managing the disease with medications and surgery. Next. So some of the medications that we use, these are just 6 broad categories of the medicines. We use 5-aminosalicylates, which is the first box, and that's primarily for ulcerative colitis. We oftentimes end up using steroids, such as prednisone or budesonide, which can be helpful as bridging agents until we have other medicines on board that are helpful. The immunomodulators, many of you will know these medications, azathioprine, methotrexate, and less often cyclosporin or tacrolimus. And then the biologics, which have really been changing the face of treatment over the past 10 years, and now we have 5 of them. And then in addition, we oftentimes will use antibiotics as adjunctive treatments in care, as well as medications just to manage the symptoms, included in the last box. Next. So just a background to what we're going to discuss tonight, IBD costs a lot of money. There are different costs not only related to medications, but also just the healthcare in general. The healthcare costs are higher in the United States than in any other country, and they tend to be the highest for people that are very young. Less than a third of these costs comes from actual hospitalization. So many of these costs are just based on outpatient clinic visits and procedures and medications. The estimated medical expenses per year for Crohn's and ulcerative colitis are listed here, and roughly this is $15,000 to $19,000 a year. And these are costs to the insurer, not necessarily to you as the patient. Next. And these are some of the estimated costs of diagnostic tests, and these too can vary widely between procedures and between institutions, but these vary from small bowel follow-through, which is relatively inexpensive at $400, up to an MR enterography, which is a relatively new and very good procedure, but this can cost upward of $6,000. Next. Additionally, surgical costs can be very expensive. So these are some estimates of different procedures that are commonly performed in patients with inflammatory bowel disease. And as you can see, these can run anywhere from $30,000 to $45,000 for total surgical costs. Next. Hospitalization can be expensive, and this is, again, very hard to estimate, but a typical hospitalization without any specific procedures or interventions can cost approximately $2,500 per day. Next. Medications, which is largely what we'll be talking about tonight, can vary widely, and these are just some estimates of costs for the common medications that we use for IBD, the mesalamine products, the azathioprine and 6-MP, as well as the methotrexate. Next. And then cost of biologics, and these, of course, are much more expensive medications, and these can vary per dose, but are roughly all in the same range of between $2,000 and $3,000 per dose. Next. So what happens when medications are very expensive? Some of the cost is shifted to patients. Insurance companies will oftentimes pick up the majority of the cost, but if patients have to pay a significant amount out of pocket, it can certainly make it unaffordable, and this can oftentimes lead to the inability to really stay on your medications or non-adherence. And if you're not adherent to your medications, that oftentimes translates into more frequent flares, which then leads to increased hospitalizations and oftentimes a worsened quality of life, more frequent healthcare visits. And so it ends up being a vicious cycle. So I'm going to turn the mic over to Elizabeth now to talk about some of the resources we have available.
Thank you so much. So what we're going to do now is talk a little bit about the organization I work for, Needy Meds. and give you some general information about how to find resources to help you afford your medications and healthcare costs using our website and the information that we list. Just a quick background, we're a national nonprofit organization. We were founded in 1997 by our current president, Dr. Richard Sagel. Our primary mission is to provide free access to accurate, comprehensive, and up-to-date information about programs that help people afford their medications and healthcare costs. All of our information is available on our website, univent.org. It's free and easy to access. You can access it anonymously, and most importantly, it's updated regularly. The majority of our staff do spend their time updating the information on our website and making sure that it's accurate for those who visit our website each day. Next. This is just a quick screenshot of our homepage so you can get a sense of how it's set up. You'll see down the left-hand side there some of our major categories of information. So that's what we're going to quickly go over today, some of the main categories of resources that we list on our website that may be able to help you. You can think of us sort of like the yellow pages for all different kinds of programs and resources that can help you with your healthcare costs. Next. So the part of our website that probably gets visited the most and will be most helpful for you is our database of pharmaceutical patient assistance programs. These programs are usually run by the pharmaceutical companies that make the medications. They provide the medications for free or very discounted for those who qualify. It can get a little bit confusing because each of these programs have different guidelines, different eligibility, usually based on income and insurance level. And they all each have a different application as well. So it can get a little overwhelming. We try to make it really easy for you to quickly go on our website, look up your medication that you can afford, and see if there's a program available that may be able to help you. One thing to keep in mind is these programs do require your healthcare provider be involved. They usually at least need to provide a prescription to you. Usually they will also need to fill out a section of the application and sign it as well. So you just want to keep that in mind. Next. So in addition to that section of our website, I just wanted to highlight a few other parts of our website that you may be able to help you. Our diagnosis-based assistance section on our website are programs that help people based on a specific diagnosis. What's really helpful about this part of our website is they won't just help with the cost of medications, but they'll help with all different costs of healthcare that you may be struggling with, whether it's just general living expenses, travel costs, you have to travel somewhere to get treatment, anything like that. There may be a program out there that can help you. So it's a really good place on our website to look at. If you're just really looking for you're really struggling with various costs associated with IBD, and you want to see what help is out there. And like in a lot of parts of our website, you can look up these programs in a few different ways, either by your condition, specifically in your location, or you can also look it up alphabetically by the program name. Next. A few other resources on our website that you can look at. We have a section called Coupons, Rebates, and More. These are going to be coupons and rebates and other discounts offered on prescription medications as well as over-the-counter medications. This is also a good place to look if you need help with the cost of the copay, as we list copay cards in that section. So it's a good place to look for that. Also, if you do need help on an over-the-counter, we list coupons for over-the-counter in that section as well. We have a list of over 13,000 free or low-cost clinics. So you can actually go to that part of our website, put in your zip code, and find a clinic nearby to you that will be able to provide you either free care or low cost, or they'll lower their costs based on your income. So it'll include free clinics as well as federally qualified health centers as well as other facilities that will discount their prices based on someone's income. We have a few sections of our website. One is camps and retreats, and another is called scholarships. These are all going to be offered based on a diagnosis. So again, you can go there and see what's available for people with IBD. It's also available for people with family members with specific diagnoses, so it's a good place on our website to check out. And we do also have a list of all the government programs. So that's going to be programs that are created, sponsored, or funded by state, county, or local government. So that's a good place to look for kind of your state and federally sponsored programs that are out there. Next. So a great place to start on our website, because as you can tell if you've never been to our website, we have a lot of information on there, is the Crohn's disease and ulcerative colitis resource page. A few years back, we actually worked with the foundation to put together this page. So the Crohn's and Colitis Foundation of America helped us put together this page. And what you can do when you go there is you can find links to, you'll see a list of medications that you might be taking if you have IBD, and that's going to link you right to all the patient assistance programs that are available for that medication. It's also going to link you to the diagnosis-based assistance section of our website, and you can find programs there that might be able to help you, as well as other information and links back to the CCFA website as well. So it's a really good place on our website to start your search for assistance, and instead of jumping all around, you can start on that page and quickly see what help we know is available. I think we have next a picture of it on the next slide. So I know this is really small, but just to give you a sense of it, you can see in the middle there, that's the list of medications. The bottom has a link to the diagnosis-based assistance sections. That left-hand side box has links to the CCFA website. So it's a really great place on our website just to kind of quickly find out about all the help that might be available for you on our website. Next. The last thing we're going to go over is our discount card. This is an additional resource we offer besides all of the programs and resources we list on our website that we just briefly talked about. This is a free card that can save people up to 80% off the cost of medication. You can use it on prescription medications, over-the-counter medications, and medical supplies written as a prescription, even pet prescriptions you can purchase at a pharmacy. There's no activation or registration needed for the card. There's really no residency, income, or insurance guidelines at all. And it's also accepted over 63,000 pharmacies across the country, including all of the major chains. That's Walgreens, Walmart, Rite Aid. They all accept the card as well. Next. So basic rule when it comes to using the card is it cannot be used in combination with insurance. So of course that means anyone who is uninsured or in between insurance could use it. If someone does have insurance, whether it's public or private plan, they can use the card instead of their insurance if maybe they have a medication not covered, they're in a coverage gap like the donut hole, they have a very high copay or deductible, they can use the card instead of processing it through their insurance. So they would just go to the pharmacy and say, I want to use this card to buy this medication instead of processing it through my insurance. The savings are up to 80%. On average, you can save about 45% off the cash price of the medication. You can actually go to our website and print out a card and use that piece of paper just as good as a plastic card. Or there's also information on our website about sending us a self-addressed stamped envelope, and we'll mail you out a free card as well. Or if you work for an organization, we'll mail you out a supply of our cards and brochures. So we're always happy to do that. Next. So that was a lot of information, especially if you're not already familiar with NeedyMed. So this is just sort of a quick checklist to keep in your mind when you're on our website or kind of trying to go through our resources. I always say you want to start by looking for a patient assistance program for your medication, because getting your medications for free or very discounted is always your best bet. You can always try using the discount card, just keeping that in your wallet. You should never have to pay full price on a medication if you don't have to. If there wasn't a patient assistance program, maybe you needed some quicker assistance, help on an over-the-counter or a copay, you could try checking our coupons, rebates, and more section. If there was no patient assistance program, or maybe you needed help with some of your other costs associated with IBD, but maybe not the cost of the medication, you could look in our diagnosis-based assistance section to see what kind of help and programs are out there. Next. So this is just a quick contact information. You can always email that email address. That's checked daily, and we also do have a toll-free helpline number that's staffed 9 to 5 Eastern Time. And our call center staff will either kind of explain to you how to use the website, or if someone's not comfortable using the internet, they will look up some phone numbers and provide some information about resources that might be able to help that caller. So you can always call that number, and if you don't get us, leave a message and we'll call you back, hopefully very quickly. So with that, I think I'm going to be passing it along to Suzanne, who actually is going to be going into more specific patient assistance programs that may be able to help you as related to the medications that you might be taking. So Suzanne?
All right, thank you, Elizabeth, for that overview of the patient assistance programs and all the resources that are available for the disease, for the inflammatory bowel disease. As you said, I am going to be talking about the specific drugs that many of our listeners are going to be familiar with to treat IBD and some of the copay assistance or financial assistance programs for those. The first couple of slides are going to be about the mesalamine medications, which would probably be very familiar to our audience. Asacol HD, for example, there is a copay card available for that. You can call a phone number, or sometimes your provider's office might have that. With that card, you can save up to $50 per prescription. Lialda, again, there's a copay card available. You can call the toll-free number there or visit the website. And with that copay card, your prescription can be as little as $10 per month. Lialda also does have a free medication program if you're eligible, and the number there for that would be to call Shire Cares. And Aprizo, another mesalamine medication, again, a copay card is available. You can pay as little as $10 a month. Next. Delzacol is a newer medication, and unfortunately there is no copay card or assistance program for this yet. Pentasa, again, no copay card, but through the Shire Cares program like Lialda, you can get free medication if you're eligible. But you would need, the help of your provider to fill out forms, etc. Canasa, there's a copay card available. You could save up to $60 per prescription. Roasa enemas, no copay card, but they are available in generic form now, so that has reduced the cost quite a bit for a lot of our patients. Next. This slide talks about the budesonide formulations. Entocort is now available in generic form, so that's reduced, again, the cost a lot for our patients, but there's no copay card or assistance program available. Uceris, you can visit the website there or call the toll-free number and get a copay card, and your prescription can be as little as $25 a month for that medication. Next. Now I'm going to talk about specialty pharmacies. So what is a specialty pharmacy and when should you use it? Next. Specialty pharmacies I talk to every day in my job as a medical secretary at Mayo Clinic. They fill prescriptions for complex medical conditions like inflammatory bowel disease, and they handle medications that either are injectable or infused, biological medications, high-cost medications, ones that require special handling or storage, such as refrigeration. Next. And the advantage of a specialty pharmacy for patients with chronic conditions is they can provide a lot of help to the patient. They'll coordinate the delivery of your refills and communicate with your healthcare provider, understand and manage your condition. They can help you take your medicine correctly. There's for a lot of these drugs, the websites will provide great instruction and resources. They'll help you troubleshoot side effects, and again, how to store your medicine properly. And they'll also remind you when you need refills. So again, going to the point of adherence, making sure you're taking your medication on time and when you're supposed to. Next. Now, the specialty pharmacy is becoming important when we start talking about biologic medications. On this slide that we talk about Remicade and Simponi, there's lots of assistance out there for these drugs, and both of them have the same website, JanssenAccess.com, JanssenAccess1.com rather. And if you go to that website, you'll find lots of information about insurance investigation, the whole process of getting these drugs approved by your insurance company, because that can sometimes be the most challenging hurdle in beginning some of these drugs is getting insurance approval. So I would definitely encourage anyone who's beginning one of these drugs to visit those websites. Next. Continuing on with more biologics, the Cimzia and Humira, again, very good websites. Both drugs have, and they both have assistance programs. Humira, if you're eligible, for example, your copay could be as little as $5, and that's pretty good for a medication that's in the thousands of dollars per dose. And some of the Humira, for example, also offers a free medication program. There is an application for that, and your provider has to help fill it out, but it's a very good option for those who are underinsured. And next. And I'll be turning the program back over to Karen Hansen.
Well, thank you, Susie. That was a great, and Elizabeth, that was a great overview. I'm just going to change gears a little bit and talk about some other issues that our U.S. patients face with living with inflammatory bowel disease. And one of these is, so when you're employed and you lose your employer-provided insurance. So I think many of us are aware of COBRA coverage. Or conversion coverage, and I'm just going to briefly outline this. This is kind of an extension of your benefits for 18 to 36 months after you've left an employer, and only applies to larger employers, so those with more than 20 employees. If it was a private employer, there's a number here that you can call to see about, check into your benefits for that, and then of course as a federal employee, it's a different number. Sometimes usually these are group plans that would just be continued, but sometimes you're able to convert it to an individual policy. The best way to look into this too, other than calling the phone numbers, is to contact your State Department of Insurance or to look at the web address that I've got listed on the slide here. Next. And then changing gears again, looking at some of the other changes in healthcare insurance coverage in the future. I'm sure everyone is very aware of the Affordable Care Act, or what's been termed Obamacare. This goes into full gear in 2014. And the best way to learn about this and find out more about what your resources are is to go to www.healthcare.gov. It's a very comprehensive site, and it should be working at this point. Next. So some of the things that potentially would benefit patients, especially IBD patients under the Affordable Care Act, is that insurers can no longer deny certain benefits. So they can't rescind a policy when you get sick. They can't deny coverage to children who have pre-existing conditions. And they can't establish individual lifetime dollar limits on coverage. So these things definitely can be benefits to you when you're living with a chronic illness. It also allows young adults to stay on their parents' policies until they're 26 years of age, and there's an external review appeal process if they do for some reason deny coverage. Next. The enrollment period is currently taking place, and in 2014 set to begin. It's set up with competitive insurance marketplaces. So these are marketplaces that are either, depending on the state that you live in, they're either state-run or federally run. And about a third of the states are state programs. The rest are under the federal program. But these are for both individuals as well as small businesses. And they're set up to allow for affordable coverage. Again, currently enrollment is open. It ends on December 23rd if you want to be covered beginning January 1st, although enrollment doesn't actually formally end until May 31st of 2014. And just to let you know, we're not talking about the Affordable Care Act in great detail in this webinar, but there is an upcoming webinar at the end of January where there'll be much more information about navigating the health insurance marketplace. Next. So talking a little bit further about IBD and employment. Next. So oftentimes patients with inflammatory bowel disease, because of the unpredictable flares and feeling poorly, it can certainly impact employment, and this is usually in the form of lost wages because of missed time from work. Oftentimes symptomatic IBD patients are really even more likely to miss work than those that are doing well. And certainly Crohn's disease, because of complications such as fistulas, depression, use of immunosuppressive medication that can oftentimes make you prone to infection, tend to use more sick leave. And then ulcerative colitis patients who are older, who've had a long disease duration, are oftentimes more likely to be truly disabled. Next. So one of the things that can be applicable to patients who are trying to hold down a job with a chronic illness such as IBD is the Americans with Disabilities Act, which has been in place since 1990. And this covers employment in terms of suggesting that there's reasonable accommodations in the workplace to help you perform the job you need to do, and this prohibits any type of discrimination. So if you need further information about this act and how it might apply to you, you can visit the website www.ada.gov or call the number listed below. Next. And then Family Medical Leave Act is also something that can be used in the employment setting. So this is different than short-term disability. This is specifically time away from work to cover you when you're out sick unexpectedly. So for employers who are large enough to actually offer the Family Medical Leave Act or FMLA, they must grant you up to 12 work weeks of unpaid leave during any 12-month period for any of the following reasons. And this covers not only IBD, but in terms of IBD, where this fits is the medical leave when the employee is unable to work because of a serious health condition. And again, we have the website listed on this slide to go and find more information about this act. Next. So some of the benefits that are maybe more specific, just to highlight these, it can be used for intermittent leaves of absence. And what it offers is that you can keep your job security and restoration and all other benefits. So you don't lose benefits such as insurance, health insurance. The use of FMLA cannot result in a loss of benefits accrued, and in some cases this has to be sorted out with your HR department or your supervisor, but you might be able to use or might have to use some paid leave as FMLA leave. So it's good to sort that out with your supervisor ahead of time. Next. In terms of your responsibilities, it's important to give a 30-day notice, advance notice when you're going to be away, if that's practical. There are times when you aren't going to know ahead of time, but when you can give advance warning, it's important to do so. And to get documentation from your GI provider. And then to remember, you do have to recertify, so the form has to be filled out on an annual basis. And there may be updates requested from your HR department or supervisor periodically. And where do you get the formal paperwork? It comes from your HR department. Next. And then moving to disability. So this is just going to touch on a couple of things in terms of applying for disability. So certainly having inflammatory bowel disease, many times, again, higher rates of unemployment than in the general population, and patients with active disease tend to have higher rates of disability than those with inactive disease. So it definitely translates into greater disability when your disease is not under good control. Next. So a couple of very good resources if you are interested in researching or looking into applying for disability. The SSA, or Social Security Administration website, which is www.ssa.gov, has some very good programs to kind of walk you through and to kind of see if you would be eligible for any of the programs available. And they're listed here. So one is the Supplemental Security Income, the SSDI, or Social Security Disability Insurance, and then there's also a benefit for children, Social Security Childhood Disability. There's also a resource link on the CCFA website, and that's listed here as well. So at this time, I'm going to return or turn the mic over again to Elizabeth to talk to you about some additional resources.
Thank you, Karen. Yeah, we just are going to talk about a few more things we haven't touched on that may be able to help you. We're starting with additional resources for the uninsured. So you can apply for Medicaid or state high-risk pool insurance. And for more information about that, you can visit healthcare.gov, familiesusa.org. There are always the community health centers. Any community health center nearby to you is going to be a good resource for you, not just for healthcare, but for knowing what other resources might be available in your area. So you can go to the hrsa.gov website to find a health center nearby to you, or you can always go to our website as well to find some resources that can help you if you're uninsured. Next. Some other financial resources, there are food stamps, aid to families with dependent children, energy and rental assistance programs. The United Way, whether it's your 311 or 211 nearby to you, is a great resource. We refer people to that often when they're looking for the local agencies and programs that might be able to help them. They're usually very knowledgeable about what's going to be close by to you that might be able to assist you. So that's a great resource. And you can always check your state agencies as well. Next. Finally, these are some organizations that provide copay assistance, such as HealthWell and the Patient Advocate Foundation. The Patient Advocate Foundation will also, besides providing copay assistance, they do arbitration and mediation, and they settle issues of access to care, medical debt, job retention related to the disease. One thing to keep in mind with HealthWell and Patient Advocate Foundation and some of these other copay foundations is they have certain funds available for certain disease states that they will have money for. They might run out partially through the year and then get more funding for it. So you do want to keep that in mind, that they'll have funds that will open and close throughout the year. And then there's also the Modest Needs Foundation that provides one-time emergency grants to financially needy families or individuals. So with that, I think I'm going to be passing it over to James to talk a little bit about some specific resources that CCFA has to offer.
Great. Well, thank you, Karen, Suzanne, and Elizabeth, for your informative presentations. Before we get to the question and answer portion of the program, I wanted to discuss some of the CCFA resources that are available. Okay. So CCFA currently provides a comprehensive series of education programs, resources, and support services to members of the IBD community, including patients and caregivers, some of which are listed here on the slide. The Erwin M. and Suzanne R. Rosenthal IBD Resource Center, also known as the IBD Help Center, is a free service designed to provide members of the IBD community with disease-specific information, guidance, and support. The IBD Help Center is staffed by master's degree level specialists who provide education on IBD management, available treatment options, and coping strategies, as well as referrals to helpful resources and programs such as financial assistance. The IBD Help Center, of course, can be reached toll-free by phone at 888-MY-GUT-PAIN or 888-694-8872, or through email at info@ccfa.org, or via online live chat, social media, postal mail, or even fax. And just to let you know that the IBD Help Center is available, once again, Monday through Friday, 9 a.m. to 5 p.m. Eastern Standard Time. So as you already know, a webcast is a topic-specific online program designed to educate viewers on various aspects of IBD. And all of CCFA's live webcasts are recorded and placed on CCFA's website for individuals to download at their convenience. And our webcasts cover various topics ranging from disease management all the way to diet. So if you are interested in learning about upcoming teleconferences or viewing a previously recorded webcast, you can visit the following website, is www.ccfa.org/resources/webcasts. And if you are looking to connect with other patients, CCFA support services provide an empowering environment where IBD patients and their caregivers can find guidance, a sense of community, as well as some valuable resources. CCFA's community website is actually a space where patients and caregivers can connect with one another through an online support group. And when you're on the website, visitors can also enter into topic-specific discussion groups, view or share personal stories, and actually get some of their questions answered by IBD experts. And to view that resource, you can go to the community website, which is just www.ccfacommunity.org. We also currently host in-person support groups at the chapter level, as well as a mentorship program called Power of Two. The Power of Two program allows patients that are looking for guidance on a specific issue or to simply speak with a peer from within the community who has traveled a similar path or who has had a similar experience. And that support is provided through many means. It could be email, phone, or Skype. And to learn more about these support programs, you can find your local chapter's webpage by visiting ccfa.org/chapters. Next. So our next webcast will cover the health insurance marketplace and will air on January 29th, 2014. And if you are interested in registering for this webcast, please visit the webpage that's listed on the bottom of the slide, or you can go to ccfa.org/resources/webcasts. Next slide. So Take Steps for Crohn's and Colitis is CCFA's family-friendly walk program dedicated to raising mission-critical funds and awareness for IBD. Within the last 6 years, the program has actually raised almost $40 million to support our mission. And the program is held in all 50 states and in more than 170 communities across the country. So if you're looking for a way to get involved with CCFA or to simply find a walk in your area, you can please visit the website listed on the bottom of the slide, cctakesteps.org. Next. And for those of you who are a little more ambitious, CCFA has its Team Challenge program. And Team Challenge is an endurance training and fundraising program. So through Team Challenge, you can actually participate in a half marathon or even experience a triathlon while at the same time helping to find a cure for Crohn's disease and ulcerative colitis. So to find out where and when the next Team Challenge event will happen, you can once again visit the website that's listed on the bottom of the slide, which is ccteamchallenge.org. Next slide. Okay. So I would also like to encourage all of you to complete the post-program evaluation. Your feedback actually helps to ensure that our programs are meeting your expectations and helps to shape future programs. And the evaluation can be found at that SurveyMonkey webpage that's listed on the slide. So now it is time for the question and answer part of our program. And for everyone's benefit, of course, we would like to keep the questions general and related, of course, to the topic of financial management. And webcast participants can once again ask their questions by entering the question into the control panel, which should appear on the top right of your screen. Okay. So the first question I will pose to Suzanne. And the question is it possible to negotiate bills with hospitals or private practices?
Boy, that's probably not a question that I can effectively answer. I don't do a lot of billing in my job. I certainly work with the medication aspects of things, but I don't know about that. I think in Mayo Clinic, for example, people can talk about their bill and make payment arrangements, but that's about all I can say about that question.
This is Elizabeth. We actually at EDMES just had a webinar today, kind of similar to this topic about finding out what your healthcare costs really cost, procedures and medications, and talking about negotiating prices. So a recording of that will be on our website in the next week or so if you want to check that out. And I think it is feasible from what I learned from the webinar today and our hosts on that webinar. So I think you can do it. I think it helps to do it sort of in advance. I think it's harder after the bills have come out, but I think it's still possible.
Great, thank you. And maybe, Elizabeth, you could answer this question. Are there income qualifications based on each payment assistance program for IBD medications?
Yeah, each patient assistance program is going to have an income guideline. Usually they base it on percentage of federal poverty level. So some of the programs, they'll be as low as 200% of federal poverty level, all the way up to 400 or 500% of federal poverty level. So there is a pretty big range, and they're not always just for very low-income people. So they'll always write that on their application. It'll be on our website where we list the eligibility. And if you are on our website looking at a listing, we'll have a little calculator button on our listing where you can actually click that and put in your income to find out your federal poverty level percentage. So we try to make it really easy. So it's usually what they base their guidelines on.
Great, thank you. And Karen, what advice do you have on communicating with the healthcare team about financial concerns?
Well, I think it's just good to be very upfront with your provider if you're seeing a physician or a nurse practitioner or physician assistant, to let them know up front what your healthcare or what your financial situation is, if you're insured, if Medicare, Medicaid, uninsured. We can tailor the topic then to finding medications, because we oftentimes will have medications certainly that are generic or less expensive and equally effective, and we might tend to go toward those medications versus trying to get approval for something more expensive. But good to have that conversation. I think we try as providers to be mindful of that up front, but we might not always get there. So it's perfectly okay to bring it up and let it be kind of upfront and central to the discussion that we have.
Great, thank you. Elizabeth, maybe. Next question. What if someone is receiving a treatment or a test considered experimental? Are there options for appealing the experimental designation?
I'm sorry, did you say this is for me, Elizabeth?
Sure, if you feel comfortable answering.
I'm not really sure. I don't know if Suzanne or Karen have any thoughts on that.
Susie, I'll probably let you
Yeah,
tell them about what we do.
This does come up quite a bit at Mayo Clinic, and we often end up having to write letters to insurance companies explaining the rationale or the medical necessity for the particular tests diagnostic tests we're doing. Some of the tests, are expensive and state of the art, especially here at Mayo Clinic, and insurance companies maybe just want to hear more about why we're ordering those as opposed to some of the less expensive tests. But it is possible. We as I said, do it quite often and are often very successful in ultimately getting coverage for these tests.
Okay, great. And maybe Karen, what recommendations can you provide to someone currently taking a medication that insurance will no longer cover, say, in January?
Yeah, I think it's good to look into all of the resources that we've talked about tonight. If there's a patient assistance program that would cover the cost of the medication, if needy meds, if it is, I think Elizabeth talked about the drug card that would perhaps cover it a case where insurance is no longer covering the medication. It's the days where we used to have samples that we could provide, I think those are bygone days, and so we really have to come up with other resources to cover. Sometimes we can look at maybe changing to another medication if we think it's equally effective, and if it's on the formulary for that insurance company, sometimes we can switch. Sometimes if we really feel that medication is the best, we can, as Susie said, write an appeal letter explaining why we think the patient needs to be on that medication and why it should be covered. So again, it's a process, and we just have to try to talk through what our options are, and then proceed with programs or letters.
Great, thank you. Okay, and the next question, how can you tell if an insurance plan is good for someone with IBD? So I guess, are there particular things to look for when selecting a plan?
Well, and if, again, I think if that's going to be under the Affordable Care Act, I think there's platinum, silver, gold. I think there's different plans offered, and the more expensive plans are probably going to provide better coverage. So someone with a chronic illness probably needs to look at a plan that's going to provide better coverage. But so if you're looking for that, I think the program in January should be helpful. I think if you're employed by your employer's plan, is probably going to be the one that you need to use. I don't know how much leeway you have in terms of picking an individual plan. So that's a little bit difficult to answer, but.
Okay, great. And I think that it would be really helpful for that person to attend that January webcast.
Yeah.
Okay, next question. What about finding coverage for things that are not treatments? Say, IV hydration therapy, ostomy stuff. Can someone address that?
That would be a good place. That would be a good resource on our website. Would be the Diagnostic Assistance sections on the NEDMED's website. That's where we'll list programs that help with all different kinds of healthcare needs and costs, not just specifically medications. So it might be one place to look to see if there's a program that will generally help you with those kinds of additional costs.
Great. Okay. Next question. Do you know of any good programs to help with medical debt? I guess that has already occurred. Elizabeth, do you have any advice for that?
We, at NEDMEDS, we actually do work with a company that provides medical bill mediation. So they will kind of help you negotiate. If it needs to be over, I believe, $1,000 of unpaid medical bills, and then they'll help you negotiate down that particular bill. There is a small upfront fee, but they will refund that fee if they're not able to reduce the debt that you have. So that's one thing off the top of my head that I know of, and there's a link to that or there's information about that on our website. But there are other groups, I think, like that that'll sort of help you negotiate the bills if you don't feel comfortable doing it.
Great. Thank you. And you can also follow up with the CCFA's IBD Help Center for information and resources on that as well. Next question. Are there any assistance programs that help with applying for SSI?
I'm not aware of any assistance programs. I had looked at the website, and it's actually very helpful in terms of walking you through, and before you actually commit to anything, you can walk through and sort of fill out your profile as to whether or not you'd be eligible. I think probably another way to go at that is to find your local Social Security office and go into the office or call the office and set up an appointment with a case manager who can work through the process with you. And so most, I'm not sure how that works, but I think most counties or cities will have a Social Security office that you could go into. And that's probably the best way to go about that.
Thank you. Next question. Where can we find information for families who are not under the federal poverty level but still have a lot of out-of-pocket costs due to their IBD?
So that's a very good question. And kind of again depends on what the costs are. If it's for specific medications or care, I think it's all of the resources we've talked about tonight. That's probably the best thing, is to start looking at resources available through the ones we've talked about tonight. I don't know.
I would also say that programs do make exceptions. They make hardship exceptions. So, I always say, when in doubt, call. If you are just over an eligibility for a program, you're making just a little bit more than is the eligibility, always call and ask and see if they're willing to make an exception, because they will sometimes.
Great, thank you. The next question is, how do you find a specialty pharmacy?
I can field that one. You don't usually have to find one. They'll find you. Because most insurance companies will require, if a biologic medication or a specialty medication is prescribed by your provider and submitted to your insurance, you almost always, if it's just to a retail pharmacy, for example, it'll almost always be rejected at that level, because your insurance company, and each insurance company will be different, will require you to use a specialty pharmacy for a lot of the reasons that we outlined before. They require special handling or care or refrigeration, things like that. They wanted to go through a specialty pharmacy, also to go through a prior authorization process, the insurance coverage review, things like that. So you'll find out quickly what specialty pharmacy you're going to be using after you've been prescribed a medication.
Okay, great. Thank you. Next question. We started to talk about the income guidelines. It's a general question. Does this include total household income or the individual's income only?
It's usually the household income is usually what they base it on.
Great. The next question is, where does prescription coverage fall under the ACA?
That's a very good question, and I'm not certain I can answer it. Again, a good reason to go to the webinar at the end of January.
Great, thank you. Next question. Is it true that getting disability benefits can be very difficult for those with IBD?
It is true. I think I've heard that typically as many as 40% of them are rejected the first time, and oftentimes it takes 1 or 2 appeal processes to get it approved. So it's important to, be consistent and to get the support from your providers, particularly your GI provider, to support the medical need for disability. But it is a process. It doesn't happen overnight, unfortunately.
Great, thank you. Another question that you might know or not know. Is it true that one must be at an employer 1 year before the Family and Medical Leave Act will be?
I think there is I haven't heard that specifically. There are certain requirements, and I think you do have to be there for 12 months, consecutive months, before you would be eligible for FMLA. I'm not entirely certain, but I think that's true.
Great, thank you. Sorry, I'm just scrolling through the questions.
Okay.
Okay. There's lots of questions about how do we get a copy of this great presentation, which is wonderful. We'll actually be posting the presentation very shortly on CCFA's website. And for everyone that's participating, you'll receive an email about it. Is disability only for those that are unemployed, or is there disability for employees that can be used if on a long-term leave?
So James, can you ask that question again? I'm sorry.
Sure. Is disability only for those that are unemployed, or is there disability for employees that can be used if on a long-term leave?
I think that there are programs for both. One of them is based on, and that's where kind of going into the website or working with a Social Security office would be helpful, but one of them is based on actually taking benefits that you've paid in as an employee over the years versus the other program. So I think both, your employment status doesn't really play a part. It only plays a part in which program you would be eligible for.
Okay, great. Thank you.
I did find the answer to the previous question. So in terms of the FMLA, you have to have worked a total of 1,250 hours during the last 12 months prior to a leave. So that's the requirement in terms of being eligible for FMLA.
Great. Thank you for that multitasking.
All right, thanks.
Okay, so it's just about 9 o'clock. So this is going to conclude the question and answer session. So at this time, I'd like to say thank you to our wonderful speakers for their insightful presentations and for volunteering their time. And if your questions were not answered, again, please contact CCFA's IBD Help Center Monday through Friday, 9 a.m. to 5 p.m. Eastern Standard Time via the telephone listed at the bottom of the slide, 888-694-8872, or by sending us an email at info@ccfa.org. And as I mentioned, an archive of today's program will be posted on CCFA's website within a week. And again, I would like to encourage you to complete the post-program evaluation. Your feedback is very essential and helps us shape future programs. And on behalf of the Crohn's and Colitis Foundation of America and NeedyMeds, thank you for joining us, and thank you for your support of CCFA. This concludes our program.